We'll now speak to Aseel Geries, who's an activist. She's a public health specialist and a civil servant with Sudan's Federal Ministry of Health. Aseel, you escaped from Khartoum to Wadi Medani in Al Jazeera state, and that's where you're speaking to us from. Just tell us, first of all, what's it like where you are in Al Jazeera state? Any sign of fighting there at all?
Hello there. No, I'm actually right now placed and located in Wad Medani, Al Jazeera. And luckily enough, Jazeera Wad Medani is basically the only state, I'm not really sure about this, but we do not have an RSF base. That's why it's not a targeted state. And we only have a military base here. So it's quite protected. And that's why a lot of people from Khartoum are fleeing here to Jazeera Wad Medani.
What was your journey like from Khartoum to Al Medani?
It was quite scary because I've left on April 17th, which was the third day of shooting. And just an hour before I left the city, me and my family were hesitant. We were scared to leave in such circumstances. The main road leading to Al Medani, the travel highway, was actually blocked. And it was actually full of checkpoints of RSF, and they were captivating people, searching people. They were the stealing of people's belongings, and so it was not the safest road. So we had to find another road, which was the road to east and through Soba Bridge. And the streets were just so empty after when we decided to leave it towards about noon. It was really empty, but we were very hesitant to leave because we have not heard of many people who have traveled immediately. So right after the road was good, it was there. We've been met by some checkpoints. Both were RSF. They did not search us because we were a family and we were driving in our own car. But they stopped a lot of people in big cars too. Throughout the road, it's just villages. So there wasn't many checkpoints. There was nothing. It was safe. And right after we got to Medani, I used social media to even speak about my travel and my journey, and my tweet went viral. It was all over WhatsApp, and a lot of people were actually able to come to Wad Medani through the road that I've described them. So yeah, that was my journey.
What about once people like yourselves and the others that you were just telling us about, once they get to Al Medani, what sort of help do they have there? And when you look at the situation in Khartoum, particularly when it comes to the state of the medical facilities there, what's it like in Medani and Jazeera state? Are people able to get at least the medical supplies that they may need?
100%. Actually, Wad Medani is one of the states that is fully equipped with hospitals, different kind of hospitals. You have urology, you have the chemotherapy, you have oncology, you have emergency hospital, you have pediatric hospitals, all functioning 100%. So a lot of cases have been mobilized from Khartoum to Wad Medani throughout the past 2 weeks. But unfortunately, people here have the medical cadre, even in Wad Medani, is now drained. We're running out of medical supplies because the Sudanese health system is a centralized health system. So most of the medical supplies come straight from a body called the National Medicine Supply Fund, which is part of the Federal Ministry of Health. And unfortunately, and because of the war, this whole system has been shut. We're running out of medical supplies here. We're getting a lot of referrals from different states, from Khartoum, and it's just a very dire situation.
So what's being done? Is there anything at all? Is there anything at all that's being done to try to get medical supplies into Medani? Obviously, there are a lot of agencies who are trying to get supplies into the country, but as we know, transport and safe routes are the real issues here, aren't they?
It is. And even if they try to get stuff from Khartoum, where are you going to get the stuff? Because as I mentioned earlier, the only facility is the National Medical Supply Fund. The pharmacies in Khartoum are in total lockdown. Only a few are open. Most of the things here are running out. We have WHO, we have the Red Crescent, we have the MSF that have come to Jazeera state, and they are trying to provide support. But unfortunately, even them cannot help because the funds cannot be transferred. The central banking system in Sudan has been shut down, so millions of dollars for aid cannot be received here. What we're trying to do as volunteers is that We have civil society organization, medical organizations that are trying to help. So we buy things with our own money to the public hospitals. I myself, I'm receiving funds from many organizations, and I'm trying, and from individuals through civil society organizations, and we are trying to get medical supplies and essentially life-saving medicines. But unfortunately, even then, and because of this crisis, the prices are shooting up the sky if it's available.
Right. Okay. We'll leave it there. Thank you so much, Aseel Geries, for speaking to us. Thank you.
Very much welcome. Thank you.
Now,